Megan Rodriguez. I'm the outreach coordinator here at the Woburn Senior Center. I'm here today with Elaine Miller, the regional Shine director, and Kathy DeCenzo. She is one of our Woburn Shine counselors with 10 plus years of experience in the Shine world. And we'll be here today to talk about Medicare and how to get in touch with a Shine counselor, all the ins and outs, and so I'll let Elaine take it.
Hi, I'm Elaine Miller. I'm the Regional Shine Program Director at Minuteman Senior Services in Bedford, Mass. And I'm here today to talk about the Serving Health Information Needs of Everyone program at the Woburn Senior Center to let people know what Shine is and how they can access Shine and what Medicare beneficiaries need to be aware of, particularly during this time of open enrollment, which began October 15th. Shine program has been available to Medicare beneficiaries for more than 30 years. It is a no-cost program. It's nationwide, and our 45 counselors are a group of 1,000 state-certified Shine counselors here in Massachusetts. We work under the umbrella of the Executive Office of Elder Affairs, who provides funding and support for our program and all of our training. The Shine program nationally is referred to as SHIP, but there's one in every state, and the overarching organization is the Centers for Medicare Services. So our program can help Medicare beneficiaries of any age, over 65 on Medicare, and under 65 on Medicare with a disability. Right now, our program's been challenged, as many programs have been, due to the COVID-19 issue. So since March, there has been no face-front counseling. Typically, our counseling sessions would be performed on-site at the Woburn Senior Center or at one of our other 17 locations throughout the region. But we had to pivot, and our counselors have done a wonderful job of doing that. So all counseling right now is done remotely, either by telephone, and some sites happen to use Zoom as well. So that's our Shine program in a nutshell. It's pretty much made up of volunteers, very dedicated volunteers, and I'm going to introduce Kathryn DeCenzo, who is one of those very dedicated Shine volunteers serving Woburn beneficiaries. Kathryn is one of 3 counselors covering Woburn, and she's going to talk right now about what Medicare is and what you need to know about Medicare. Welcome, Kathryn.
Thank you, Elaine. A lot of people are confused, and they also want to know what is Medicare. So one thing is that Medicare is not free. And the other thing is people come in and they say, you know, I feel really stupid, I don't understand Medicare. Well, Medicare can be very confusing, and you have to remember that while you're working, you don't have a lot of choices with your insurance programs. So when you turn 65, all of a sudden you have like 40 odd plans to choose from in Massachusetts. Everybody is going to try to tell you what to do, your family, your friends, your cousins from out of state. Try not to listen to everybody because you're just going to confuse yourself. The other thing is you're going to be inundated by ads on television, especially at this time of the year with open enrollment. And the other thing is you get lots of print ads, and they can be very confusing. You have to kind of learn to read the fine print. The one question that we often get is, am I going to be, penalized if I don't enroll in Medicare when I'm supposed to? Yes, you will be. So you do have to pay attention to your birth date, and also if you're with an employee plan, you can delay it. But we at Shine will be more than happy to explain that to you. Or there are also lots of websites and books, Medicare and You, that will help you explain those. But just what is Medicare? It's a federally funded health insurance that covers some of your expenses. And it's generally available. Medicare coverage is generally for health care services that are considered medically necessary and reasonable for the treatment or diagnosis of illness or injury. So there's 4 parts to Medicare. Medicare Part A is hospital insurance. This is while you're in the hospital. Medicare Part B is medical insurance, which is anything outside of the hospital. Part D is Medicare prescription drug coverage. And Part C, which is actually an alternative, is a Medicare Advantage plan. This is an HMO or a PPO. It includes A and B, usually D. Okay. So the original Medicare is Medicare Part A and B. For A, it would be premium free for most people. And most people do enroll in Medicare Part A when they're turned 65 because of the fact that it is free. If you are presently contributing to an HSA, a health savings account, you do not want to enroll in Medicare Part A when you turn 65 if you continue to contribute to your HSA. One of the Medicare Part A does have gaps, and you also have copays, and it has very limited skilled nursing, and that's really just for rehab. Okay. Part B is for your doctor's visits, for your outpatient care, preventive services. The premium varies by income. The premiums have not been set yet for 2021. The premiums for 2020 was $144.60 per person, and it's usually taken out of your Social Security. I will say that if you are earning a higher income, you may pay more for your Medicare Part B. On the gaps, there is an annual deductible. Presently, for 2020, it's $198, and it's a 20% copay for most Part B services. So Medicare pays 80%, you pay 20%. There is no coverage for hearing, for vision, for dental, and also for foreign travel. You do, with Medicare, have the privilege or the freedom to choose any doctor that you want that accepts Medicare in the country. There are no referrals necessary, and you are covered anywhere in the country or even foreign travel with Medicare. Now, Part D is a standalone prescription drug plan. The plans vary in cost. They can, the drugs that they cover do vary by company, and there may be restrictions such as the quantity limits, prior authorizations, or step therapy. So there's usually a pharmacy network that where you may get preferred pricing. So if you want to find a plan that covers your drugs that you take with the lowest cost and fewest restrictions, there are actually 27 different plans in Massachusetts. So you want to find the plan that works for you. Okay. The best way to do that is to use the Medicare Plan Finder, which is on Medicare.gov. And the other thing that you may want to do is go to Medicare.gov and open a My Medicare account. Now, on the Medigap plans, these are supplement plans that will help you pay some or all of the 20% that you would be responsible for that Medicare does not pay for. There's one plan, Supplement 1, which is actually closed to new enrollees unless you turn 65 before January 1st of 2020. There are two other different plans in Massachusetts. It's called Core and Supplement 1A, and they will pay some or all of the copays that Medicare does not pay for. These plans will vary from state to state. This is the one thing that you really have to be careful of, is that people, in Florida or New Hampshire, their coverage will be different than Massachusetts. So the supplement plans are particular to Massachusetts. There's also Part C. This is Medicare Advantage plans. These are the plans that you see mainly in print, and also you see a lot of advertisements for Medicare Advantage plans. These are PPOs or HMOs. They combine Medicare Part A, Part B, and usually Part D. You must still be enrolled in Medicare Part A and also in Part B, but you are not insured by Medicare, you are insured by a private insurance company. There are probably 40 different plans in Massachusetts. One of the biggest things with the Medicare Advantage plans is you must stay within the network. You have referrals, and you also have co-pays and co-insurance. These plans can offer additional incentives such as vision coverage. Sometimes they have weight management reimbursements. They might have gym membership reimbursements. So you have to contact the individual plans to find out what the added benefits are. And you have to remember that if you're not going to use these benefits, then they may not be beneficial to you. You may want to be careful about that. One thing to really remember is that you cannot be enrolled in a Medicare Advantage plan and a Part D plan. Okay, you have to accept the Part D plan that is part of the Medicare Advantage plan. You really have to check with your doctors to make sure that they take the Medicare Advantage plans. Not just any of them, but just make sure they take the one that you're looking at. Many doctors do not accept the Medicare Advantage plans. So if you have particular doctors that you want to see, you very much have to research to make sure that they are involved in that. One of the biggest changes for 2021 is there are a few new Medicare Advantage plans that are targeting veterans. You know, they do not have drug coverage because they might have the coverage with the VA and things of that sort. And the other thing is that in the past, if you had end-stage renal disease, you could not have a Medicare Advantage plan. This year you could, or starting with 2021. Elaine, do you want to discuss what Medicare costs?
Sure, Catherine, thanks. Medicare Part A is typically no cost, as Catherine had mentioned. People have paid into Medicare Part A during their work history. So if you've worked 40 quarters in the United States and you're a citizen, you're eligible for no premium Part A. Part B, as Catherine mentioned, right now there is a cost share that's deducted from Social Security or billed to you quarterly if you're not yet taking your Social Security, and that cost is $144.60. We have not received the increased pricing for Part B, and we won't see that until November when it's released by Medicare. If you were to choose at 65 to join Medicare Part A and B and not pick up a Medicare Advantage plan or a Medigap supplement plan, your out-of-pocket costs could be pretty expensive. For example, the first day in the hospital, if you were to slip and fall and stay overnight, would cost you out of pocket $1,408. So Medicare was designed and enacted in 1965 really not to cover 100% of your health care, but to cover about 80% of your health care costs. Medicare Part B also would involve you paying a 20% co-insurance for all of your medical services that are done on an outpatient basis. That includes diagnostic testing, other labs, MRIs, and sometimes the chemotherapies that are administered in a hospital setting and covered by Medicare Part B. It can be extremely expensive for individuals once they've been diagnosed with a particular illness to continue to cover the 20% out of pocket. And that's really why we urge people to talk with their Shine counselors about their options and choices. And a Shine counselor can really help them make a choice based on their own health needs, their fitness, the prescriptions that they take, and the flexibilities that they need. If they travel often out of country, if they want to go to a preferred pharmacy that's not covered under a Medicare Advantage plan, if they want to see a doctor that doesn't accept Medicare Advantage, these are all mistakes that people can not make by seeing a Shine counselor before they make their decisions. When you do earn over $87,000 as you turn 65, a lot of people are in a different income bracket before their retirement, so you would be paying a higher amount for your Part B until your income levels off to below $87,000 a year. And as Catherine mentioned, there's an annual Part B deductible, and that right now is $198. So you would pay that up front, January, February. It's based on a calendar year. The Part D drug premiums, Catherine had mentioned there's about 27 different plans available for sale in Massachusetts. The premiums range from $7 up to $135 per month. I am aware that there are a couple of plans this year that will be offering a reduced cost insulin. So they have 3 specific insulin medications, and they'll be offering those to patients at $35 monthly, which is a huge cost savings over what many diabetics need to pay for insulin. I just can't speak to the exact companies off the top of my head, so we'd have to talk to a Shine counselor to get that info. In terms of the MyMedicare.gov account, that is the best way and the most secure way for people to see and enter their prescription drugs and then speak with a Shine counselor. So if you go to the Medicare.gov website, you'll be able to set up a MyMedicare.gov account with your own unique username and password, and then you can enter your own prescriptions, and a Shine counselor can walk you through the Plan Finder tool, which is really under revision at the moment. They're making some corrections nationwide, so that should be available quite soon. If Catherine wants to talk a little bit about open enrollment.
Sure, open enrollment, you hear it all the time advertised, especially at this time of the year. It started on October 15th and it goes until December 7th. Your plan changes on January 1st. Plans change every year. Companies change what they offer, what they don't offer. Your drugs may change from one tier to another. So you want to make sure that you do compare plans every year. You also have to make sure that your own health changes or could change. Your medications can change. So you want to make sure that you compare plans and make sure that what your plan is the best plan for you at this point in time. The other thing to remember is just because you're not really a husband and wife, you don't have family coverage anymore, it's all individual plans. There are many times that husbands and wives are not on the same plan. Okay. There is a special Medicare Advantage for the Medicare Advantage plans enrollment on January 1st through March 31st, but this open enrollment is only for those people who are already on a Medicare Advantage plan. So if you're on a plan, Medicare Advantage plan, January 1st, and you decide you want to change it, you can. But if you're on original Medicare, you do have the restriction of October 15th to December 7th. So that's when you really want to see your Shine counselor and double check your drug plans and just in general to do kind of like a little tune-up.
What I wanted to add in terms of the Medicare Advantage open enrollment, the special open enrollment period, January 1 through March 31, is that people can consider this as sort of a do-over if they've made a mistake in choosing a Medicare Advantage plan initially, and they want to, for instance, their specialists do not accept the plan. They have an opportunity during those 3 months to make a change, although the coverage would not take effect until July 1st. So it's best to use your open enrollment period wisely, October 15th through December 7th, and make good decisions with your Shine counselor based on the information we receive from the Division of Insurance in Massachusetts and the Centers for Medicare Services. I did mention in terms of the insulin cost being lowered dramatically to $35. There are 9 prescription drug plans that are offering the $35 insulins, and I believe there's a choice of 3 insulins. So that's something that individuals would want to speak with their doctors about to be sure that that particular medication works with their condition. Not everybody can take every medication that's available out there. Some of the other changes in terms of this year, the 2021 changes to Medicare and Medicare Advantage and Medigap supplements. We are offering 2 new Part D plans, and those are called Elixir and SilverScript, which are now managed by Aetna. And we have worksheets that we can share with consumers when they visit their Shine counselors. The folders look like this, and it has all of the detailed information, and we can counsel people by phone or over Zoom. Other changes are the offering of telehealth, particularly now it actually began due to COVID-19, so plans are continuing to offer that. There are also a couple of Part D plans that are doubling in cost, and you will see that on your statements or your annual notice of coverage. So if you're seeing your Part D prescription drug plan double from what you were paying, you'd probably want to chat with a Shine counselor to see what your other choices are in order to save money, because one of the plans is actually going up to $87 a month, which is fairly expensive for people living on a fixed income. Another new option, which Medicare had offered many years ago, is called the Medicare Medical Savings Account. And what this program does is give you a ton of flexibility to manage your own health care. The company that operates this program is called Lasso, and it is a program where you have your Medicare Part A and B. You contribute out of your own income $3,000, and Lasso contributes and matches that by $2,000. So annually you would have a $5,000 bank of money to spend on your health care, medications, outpatient visits, deductibles for hospital stays, anything that would normally be covered under an Advantage plan or a Medigap plan, you could use your bank for. There are 2 types of banks. One goes up to $5,000 a year, and one goes up to $8,000 a year. Your contribution to that, the $8,000, would be $5,000 per year, and Lasso would match it by $3,000. The nice thing about these programs is that they roll over. So if you're a healthy individual and not using a lot of medication, you go to the doctor once a year for your physical exam, you have your mammogram or your prostate screening and other screenings, all of that money rolls over to the next year. So this is something you'd want to learn more about. If you're new to Medicare and you're if you're a healthy person and you want to have total control over your health care. So that is one addition this year. And let's see. We also have a difference in terms of step therapy, which is covered typically by Medicare Part B, and step therapy is various chemotherapy treatments that are performed on an outpatient basis. So your plans are able to offer more availability for step therapy treatment covered under the Part B co-payments. And that is a change that they've made this year. And I think I will let Catherine talk about the shingles shot and what changes are being made to that this year, because it's important for all of us to get vaccinated if we're over, I think, 55, right?
Yeah, I think so. Yeah, a lot of doctors right now are pushing, are recommending to their patients that they have the shingle shot. And a lot of times you go to the pharmacy because it is covered under your Part D plan, and they find out it's going to cost them $150, $200 or whatever, and they go, oh, I don't think I can afford that. And immediately they call the Shine counselor and they say, what's going on? Because your shingle shot is covered under Part D, what it is that you have to pay your deductible if your plan has a deductible. So it is kind of a shock to a lot of people. The one thing is, and you have to have 2 shots. So it is something that you might want to consider doing it in January or whatever, where you're paying your deductible in January, and then your second shot would be less money because you've already paid your deductible. But it's up to your doctors to recommending exactly when you should get it. But do know that it is under Part D. The one thing with the Medicare Advantage plans starting in January 1st, a lot of them are offering a special tier for their shingle shots. Some of them are only charging $20, some of them are not charging for your shingle shot at all. So this is their way of trying to keep you healthy. So it does depend on the plan. And, but you do get your shingle shot at a pharmacy, and it does come under your Part D. Elaine, do you want to talk a little bit about the fact that, all of this Medicare, all of the different parts of it can be really expensive? I'm not sure I can, a lot of people can't afford it. Would you like to talk on any assistance that's available?
Yeah, every year it seems that Medicare does experience an increase in Part B each year. Medications go up each year. Typically your income stays flat. This year's Social Security increase is 1.3%, and that will probably be wiped out by the Medicare Part B increase. And there are a lot of programs available that can assist people that are at certain income levels. And these are for people that are moderate income, not just low income individuals. The Medicare Savings Program is an excellent program. You can earn up to $1,358 and have your Part B premium cost share waived, and you can have all of your deductibles and co-payments for your various insurances covered. You can also, if you're earning up to $1,700 as an individual, still be eligible for the Medicare Savings Program, and that would strictly cover you would keep your $144.60 in your Social Security check. Shine counselors can help you with a very simple 2-page application for this. And there are individuals, due to chronic conditions, that hit what they call the coverage gap, and some people have heard it referred to as the donut hole, which doesn't make a lot of sense actually, but if I can try to explain that in easier terms, all of the Part D plans have a $435 annual deductible that you pay out of pocket for your prescriptions, and you can easily do that January, February, March, or if you're someone that takes maybe Tylenol, you'll never hit your deductible during the year. If you do have chronic conditions and take a lot of medications, you might hit the coverage gap very early in the year, and the coverage gap starts at $4,150 for 2021. Once your drug company has spent $4,150, you're in the coverage gap, and your co-payment for your prescription medications will be 25%. So if you're taking a medication that is $1,000 a month, you're paying $250 for that. In order to help people that hit the coverage gap, we can assist you in applying for Prescription Advantage, which is a state program, and we can also help direct you to private pharmaceutical sites and foundations that can help you cover the cost of your medications. So no one's stuck with these thousands of dollars of medical, prescription bills that are piling up during a 3 or 4 month period. And I think we all have someone in our family that we know that's taking a number of medications. So that is one area that our Shine program is really, we really want to reach out to people that are eligible for these programs and make them aware that they're out there. So Medicare Savings Program, Prescription Advantage Program, and the Low Income Subsidy Program are all programs for people that are at certain incomes that we can screen you for and help you apply for. We also do some work with Mass Health, and we do have a Mass Health co-locator in Bedford. So if people are doing Mass Health applications for a family member or a loved one, and they have questions, if you contact us at Minuteman Senior Services, we can work with our co-locator that works for Mass Health and help get you the straight answers. And I think that is about it. I think we've covered a lot of bases today, actually, Catherine. I do want to just add, in terms of what's on television today, right now, with people being homebound, everybody's home more often, watching television, seeing a lot of ads on television. They all look very official. They all look like they come from the government. They're red, white, and blue. It looks like a Medicare card. They're promising many benefits. If you call an 800 number, they will give you transportation. They will give you home-delivered meals. They will give you fitness benefits, vision, dental. You actually, these are private advertising organizations, and you would be wise to contact the Woburn Council on Aging and schedule a Shine appointment before you make contact with one of the 800 numbers that you're seeing all over the television, because you may end up signing up for something that you don't really want. So I just like to caution people. It's a tough time right now for all of us. Our Shine program's been rolling right along. We've seen over 1,000 people during COVID. Yes, our volume's gone down a little bit, but we have very dedicated people. Catherine DeCenzo, Barbara Mannock works here at the Woburn Senior Center, and Susan Fennelly also works at the Woburn Senior Center to help people out. And we're also very fortunate to have Megan Rodriguez join the Woburn Council on Aging as the outreach worker and as one of our newly trained Shine certified counselors. So the people in Woburn have tons of help available, and I want you to make use of it.
I want to thank Elaine and Kathy on behalf of the Woburn Senior Center for being here today with us. And I also wanted to let you know that if you are in need of reaching a Shine counselor for questions, you can call the Senior Center at 781-897-5972. That's our dedicated Shine counselor hotline. And you can leave a message with your name, your callback number. And if you've worked with a counselor in the past, you can let us know that as well, and we can do our best to reach out to you and schedule an appointment for you to talk with a Shine counselor.